Hello and welcome to Fighting COVID with me, Maythel Shukeli. Today, in this segment, we will give you the latest international stories on COVID-19 and also a recap of what is happening locally. Now, US drug maker Pfizer and Germany's BioNTech have announced that they will seek regulatory authorization for a third dose of their COVID-19 vaccine. The companies whose COVID-19 vaccine is sold under the brand name Comirnaty are developing a booster shot intended to target the Delta variant as concerns rise about the highly transmissible strain. The company said that they believe a third dose of the mRNA vaccine has the potential to preserve the highest levels of protective efficiency against all currently known variants, including the Delta. But U.S. top federal agencies said Americans don't need boosters yet and said it was not up to the companies alone to decide when they might be needed. The joint statement issued by the Food and Drug Administration and the Centers for Disease and Control saying Americans do not need booster shots yet. The joint statement was released after Pfizer issued in its statement. Americans who have been fully vaccinated do not need a booster shot at this time. The U.S. government officials have stressed that fully vaccinated people have a low risk of infection, even from the Delta or B.1.617.2 variant, which is more transmissible than earlier as the viruses. In a joint statement, Pfizer and its partner BioNTech said they have evidence of showing antibody levels 5 to 10 times higher than the original coronavirus and beta variant first found in South Africa. Almost every segment associated with the hotel industries, meetings, conferences, restaurants, destinations as weddings and family entertainment, among other things, have been crippled by the impact of the health crisis. Meanwhile, in Australia, the state of Victoria is closing its borders to New South Wales and Australian Capital Territory on Sunday amid a rise in COVID-19 cases in New South Wales, the state's Department of Health said. The acting chief health officer has declared that all of the New South Wales and Australian Capital Territory will become a red zone under Victoria's travel permit system at 11:59 p.m. Sunday, 11th of July. Starting at midnight, people residing in New South Wales and ACT will not be allowed to enter Victoria. With some exceptions, Victoria residents will be allowed to enter the state if they have a valid permit. Those allowed to return to Victoria from red zones are required to get tested and immediately quarantined for 14 days. People attempting to enter Victoria with no permit will be fined a sum of 4,957 Australian dollars and made to quarantine until they can be sent back. In the past 24 hours, New South Wales saw 77 locally acquired new cases of COVID-19 and 5 from overseas. The state has a total of 514 active cases. In comparison, Victoria has no new acquired cases. Australia began its vaccination campaign in February, but the delays of the vaccination deliveries and concerns about the AstraZeneca side effects slowed down its rate. And now with Europe, the European Medicine Agency said the side effects were more common in younger men. The medicine safety body said the benefits of COVID-19 vaccines continue to far outweigh any risk, but doctors and patients have been advised to be aware of symptoms of the heart inflammation. These include chest pain, a feeling of breathlessness, and a pounding or fluttering heartbeat. Anyone with these symptoms should see a doctor. 2 conditions were linked to the vaccines: inflammation of the heart muscles itself, known as myocarditis, and inflammation of a fluid-filled sac that heart sits in, known as pericarditis. The EMA analysis of cases found Pfizer-BioNTech 145 cases of myocarditis and 138 cases of pericarditis. 5 people have died. The review said they were all either elderly or had other health conditions. The UK's Medicine and Healthcare Products Regulatory Agency has also been investigating the link. It reported a consistent pattern of cases occurring more frequently in young males and shortly after the second dose of the vaccines. These reports are extremely rare, and the events are typically mild, with individuals usually recovering within a short time with standard treatment and rest. Most cases are thought to be within 14 days of vaccination. Now, while the risk is very rare, it is more likely to develop in young people, who are currently the focus of the vaccination campaign in the UK. Concerns about the side effects have already played into the UK debate around vaccinating children who are at lower risk of COVID. Myocarditis and pericarditis will be officially listed as side effects in the UK and Europe, mirroring a move by regulators in the US last month. The chance of these conditions occurring is very low, but you should be aware of the symptoms so that you can get a prompt medical treatment to help recovery and avoid complications, the EMA said. The link with heart inflammation was found only in the vaccines that rely on mRNA technology to train the immune system. There was no link found for vaccines such as Oxford's AstraZeneca or Janssen, which use a genetically modified virus.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Meanwhile, locally, Dr. Ahmed bin Mohammed Al Saidi, Minister of Health and member of a Supreme Committee tasked with tackling developments resulting from the COVID-19 pandemic, has said that the committee aims through its decisions to protect public health and save life. The minister pointed out that the committee's past decisions to impose lockdowns, notably during the period from October to January 2020, brought about considerable decline in the number of infections. It was explained that the gatherings, weddings and otherwise that took place during Eid al-Fitr holidays caused a spike in infection and death cases. And this is evident by the figures. The Supreme Committee also affirmed that non-performance of Eid prayers or pre-Eid souks or any sort of gatherings in all the governorates of the Sultanate. On that note, there will be no vaccination campaigns during Eid al-Adha holidays, said the minister, but the immunization drive will resume immediately after Eid in an intensive care matter. Those who made bookings before the lockdown was decided that they will not lose their reservations, adding that their appointments will be rescheduled. In other comments, it was said that the number of people vaccinated against COVID-19 touched 36% of target segments. Data of as many as 100,000 people who have been vaccinated have not yet been processed. Till July 7, 2021, a total of 1,936,330 doses of vaccines have been received, adding that the Pfizer-BioNTech accounted for most doses received administered in the Sultanate. The minister affirmed that the vaccination program will continue to be implemented, targeting at least 65% to 70% of the eligible segments before the end of August 2021. It was also stressed that legal action will be taken against any employee of a government establishment who refuses the vaccine without any convincing medical reason. In a reply to a question about shifting between AstraZeneca and Pfizer, taking the first dose from one type of vaccine and the second from another vaccine, or vice versa, the minister said that the practice of it has been common in other countries and that there is no objection to do the same in the Sultanate. The Sultanate saw a significant decrease in the number of COVID-19 inpatients at the hospitals during the last 24 hours. A social activist and data analyst said that according to the data from the Ministry of Health, the number points out to a significant decrease in new cases of coronavirus infections and ICU patients in the region. On June 10, statistics made available on Tarasud, the coronavirus monitoring app, launched by the ministry showed that the number of those hospitalized during the past 24 hours reached 137 and 501 patients were admitted to ICU, bringing the total number of patients admitted to the health institutions to 1,391 cases. The Sultanate has also recorded 52 deaths during the past 3 days. On Thursday, it was 19 deaths, on Friday, it was 15, and on Saturday, it was 18, bringing the total to 3,423. There are 3,217 new cases of coronavirus according to the daily report of the Ministry of Health. The ministry stated that the total number of registered cases in the Sultanate is 284,905, with 257,689 recovered, which is 90.45%, and 3,423 deaths, which is 1.2%. That is all for Fighting COVID for today, and see you again next week. Thank you for watching TTV.